The Jersey General Hospital Maternity Unit hasn't received any significant refurbishments during the last 25 years. A number of environmental issues within the unit have been identified that need to be addressed with the refurbishment and before the completion of the new Our Hospital project. These will include upgrading and provision of ensuite facilities within the delivery suite. The refurbishment will also provide a midwifery-led unit, which will provide much more choice for women and their families about where to give birth. The unit requires better temperature control. The special care baby unit requires refurbishment and expansion to meet modern-day standards. The existing unit will be refurbished to meet infection control standards. Provision of piped gas and gas scavenging systems will be provided, and the nurse call system will also be upgraded. All areas require full refurbishment, including decorations, floor coverings and services. The refurbishment of the existing unit is initially confined to the limitations of the existing ward footprint. However, as a result of changing practices in working methods and equipment, additional areas are required. It's anticipated that refurbishment will commence in August 2021 and will be completed in 2023. In 2018, a statement of requirement was developed for the basis of the refurbishment work. It was identified that these essential works were required to meet modernisation standards of the acute service. There was a delay in allocating and securing funding after the initial statement of requirement, and further delay due to the COVID-19 pandemic. But funding for the project has now been provided and scheduled as part of the facilities backlog maintenance budget for 2020, 2021 and 2022. We appreciate as a team that this work will be disruptive at times, but all the teams involved will be working very hard to minimise any disruption to the families that are using our service.
A 3D sketch model was prepared early on in the design process to outline the new SCBU and birthing room refurbishment proposals. The entrance and approach to the maternity ward will remain as existing. The new special care baby unit is located opposite the main entrance. SCBU will be significantly increased in size from 72 to 203 square metres. A new parent consultation waiting area will be adjacent to the entrance. A nurse station will be located centrally to the unit, featuring glazed screens to provide a visual connection to the new cot bays. 4 special care and 2 intensive care cot bays will be accommodated within the main area. A separate pressurised isolation room is located adjacent to the nurse station and could accommodate 2 cot bays. There will also be a designated expressing area for mothers, which will provide an extra level of privacy. The proposals have addressed the effect of COVID, and the provision of a new high-dependency unit with a pressurised controlled environment for infected patients has been accommodated. The area is accessed via separate donning and doffing lobbies to suit best working practices, whilst ensuring that the area is isolated from the main unit. 2 midwife-led birthing rooms with ensuite facilities will be formed during Phase 3 to provide a less clinical environment. A fixed birthing pool will be provided in one of the rooms, and both will have beds that can be easily folded away if required to increase the free floor area within each room. The remaining birthing areas will be refurbished to provide 3 new consultant-led birthing rooms, each with ensuite. The largest area will contain a fixed birthing pool to give consultants flexibilities on patient birthing plans. The refurbishment works will also provide piped gases, direct to bed heads, resuscitators, better temperature control environments in birthing rooms, and replacement of the existing nurse call system. The refurbishment works will be undertaken whilst the unit is fully operational, and a phase and strategy has been developed to ensure that sufficient birthing rooms are available at all times for the duration of the works, whilst identifying separate patient and contractor access zones. Phase 1 will form a new HDU isolation birthing area and bereavement suite. Phase 2 will create a new larger special care baby unit. Phase 3 will create 2 midwife-led birthing areas. Phases 4 and 5 will create 3 consultant-led birthing rooms with ensuite facilities. Phase 6 will include the refurbishment of the staff office and changing facilities. Phases 7 to 11 will include the refurbishment of the existing patient beds along the parade elevation.